and welcome to another episode of our program where we love to educate and inspire in the areas of health, wellbeing and lifestyle. And today we welcome back Pauline Healy, who is an aged care advocate and placement specialist. Actually, from last week we had so many questions, including questions on costings and why an advocate and all about quality facilities. And Pauline's back with us to answer some of those questions. Welcome back, Pauline.
Thank you very much, Linda.
And firstly, I suppose we could ask, what is an advocate and how can they help?
Yeah, so an advocate is somebody who is assisting the family to possibly start the communication process. They'll explain all of the options for aged care, whereabouts, what location, try and pick the right facility. And the good thing about an advocate is they've got the background information. So they do know the facilities in all the locations. Certain ones work all over Victoria, nationally. Others work in a particular area. One of the main things to look out for with an advocate is that they're independent. And what that means is somebody who will work for the client and look for the best outcome for them, as opposed to working alongside the facility and filling beds for them. Also negotiations. So once you've found the right facility, it's your choice. So an advocate can help you with the selection process. So what they'll do is they'll provide a list of selected facilities based on your needs. Could be location, could be cost, could be socialisation, and then from there they'll minimise those based on what you want and your choice. So an advocate, once you've found the facility, can also negotiate the costs for you. And that can be that could be hundreds of thousands of dollars cost savings for you. So, and we'll get into costs a little bit later on.
And what about people who are in hospital? How do they negotiate the pathway through getting there?
Yeah, well, again, an advocate is something that can help you. There are social workers in hospital and discharge planners. They don't have the time to be able to put into finding the right facility for somebody. So often they're given a list and said, here's 4 to 6 facilities with availability, go and apply for them and move. So I think the important thing is that they want the bed. And so an advocate will be able to work very quickly in that process to be able to get you out of hospital. So that does free up the bed, which makes the hospital very happy. But also will be able to coordinate the whole process for you. They can also assist speaking with the allied health, social workers, discharge planners, and they will transition you into care. Most advocates also should be offering a follow-up service, so that way after they're placed they do understand that it's the right facility, it's the right placement, and that's really important as well.
So I guess it's that whole communication between all of the facilities on offer, the departments and the family and loved ones.
Yes, yeah, definitely. It's I like to call it holistic Tetris, and that way you start from the start. You know, you find the right facility, you get to know the resident, you get to know what their likes and dislikes are, and then you're able to work through the whole process, negotiate the fees, place them, and then follow up with them, and then that's the complete package. It's really, yeah.
So it's better to have someone help you rather than do it alone, by the sound of things.
Oh yeah,
yes.
Absolutely.
Yes.
Yeah. Well, it's time saving, and often people feel very overwhelmed. They have young families, and they need that support. You know, it is a very complex thing, aged care, and there are people and specialists out there that can assist. So yeah, definitely. Mm.
By the way, I love that terminology, holistic Tetris, that you used earlier. That's a great way of helping people to puzzle things together, right. Really, because it is a jigsaw puzzle,
and
isn't it?
Get the right fit, exactly.
Yes, yes. And so, what if the person's already in care? What happens then? You know, they're already in a centre, and then they think, oh, how do I find another place? Can I do it?
Yeah, you can. You can definitely leave aged care. It's a lot easier to do that now, so you can actually give notice within 7 days. Obviously, it's important to have the supports there to be able to go forward into another facility. But if you were looking at changing aged care facilities, I believe an advocate would be the better option, given that there are complexities about continuing care and also finding the right one. So if you had an issue or there was an issue with the facility that you're at, or you're unhappy, first of all an advocate would go in and try and help that situation, try and resolve any issues that might be with the facility you're already in. If they can't be addressed and resolved, then we can look at changing facilities. It could be because the family have moved. You know, you get many people that are moving, you know, they might have been renting somewhere or moving locations and they want mum and dad closer to them. So that's definitely an option. 7 days notice is all you need to give, and your RAD is returned back to yourself, and then you can utilise that RAD for the next facility. So definitely.
Geez, that's great. I'm sure many of our viewers are unaware of how much simpler it can be to do that, and to move on. Thank you, Pauline. We'll go to the break now, and then we'll welcome back Pauline on all things costs for aged care. Welcome back, and we have more from Pauline on costs this time, Pauline.
That's right. Yes, thank you, Linda. So first of all, we've got the options that we touched on in our last segment, which was the Commonwealth Home Support Program. That's where you would go to the council and ask for some home support while you're waiting for a home care package. In that, prices would be set by the contractor, and it is a means tested fee. So depending on what you wanted, that you could get your windows cleaned, or you could have your gutters cleaned, and it might be $14 an hour. It's a lot cheaper than having a tradesperson come to your home, and it is subsidised. The pricing for that ranges around $7 per hour to say about $15 or $20 per hour, depending on the service provided. The next one we look at is home care. So there are 4 packages for home care. So we've got level 1 and level 2, which is the low care package, and then we've got level 3 and 4 home care, and that's more of a high care package. So the cost per level 1 is $9.52 per day, and it goes up to $10.63 per day for a high care package. Now, what that will provide you is a certain amount of hours per week for care, and there is a dollar figure attached to how much is provided, but that's not all to do with care. So for the level 1, you might find that it will give you 1 to 2 hours a week worth of care. For a level 4, it will give you a maximum of 12 hours per week, but that's not all care. So you do have to bear in mind with that. That is also a means tested fee on top of that daily amount. So depending on your means, over a certain threshold, that will be calculated based on your means. Then we move into a residential respite situation, and that's where you can actually get, and I might touch on what that is. Respite is for a purpose of going into care for a period of time. It could be so your carer can get a rest, it could be because you need a rest, or you might have to look at fixing something up in the home, and therefore you need to go into care for a short period of time. That amount of care is currently $51.63 per day, and any additional services that facility will charge. So that could be anywhere between $0 right through to $90 a day, and that's your respite care. Okay, so we've got residential care next. Residential care consists of a basic daily care fee of $51.63. It consists of a means-tested care fee, and that will be anything that's estimated based on your means, so asset and income. Now that will be a lifetime cap of $66,610.90. That's the current figure. That's paid over a lifetime. So once, depending on your means, when you reach that, it could be 2.5 years or it could be 10 years. So depending on your means is how often and how much you will pay. The next one would be an additional services fee. Now some of the facilities that we spoke about and that we might look at talking in the next segment will be facilities that offer additional services, luxury services, better choice of meals, lifestyle choices. They do charge additional for that, and it could be anywhere between, say, $10 a day through to $90 a day. Next, we have a refundable accommodation deposit. That's what we used to call the bond. That is 100% refundable now, and most homes will charge anywhere between $300,000 and it could be up to, say, $1.5 million for a suite. It does range and it does vary, but there's an average price of $550,000. Anything above that price, the pricing commissioner, which was set, has to approve. So they cannot charge anything over $550,000 unless prior approval is given by that pricing commissioner. So that's a good thing to know as well.
Oh, great.
One of the questions you might have would be, what if we don't have that money? You don't have to pay that lump sum. You can actually, provided you've got the interest payment, which is 4.98% currently, you can choose to pay a DAP, which is a daily accommodation payment. So you either pay a RAD or a DAP.
Oh, well, thanks, Pauline. We'll go to break now and then we'll come back afterwards with more questions. Thank you. Welcome back. And Pauline, one of the questions we've had over and over is, what if one husband, wife, partner goes into aged care? What's the situation then?
Yes, so for affordability, a lot of people worry that, you know, if mum goes into care and dad's okay at the home, what do we do? Do we have to sell the home? Look, there are subsidies for that. It's called either supported or partially supported, and that will depend on their means once again. So no, they're protected in that case. If dad is staying at home, mum or dad is staying at home, and the other is going into care, the house is exempt from any income testing whatsoever. So, and also if you've got somebody living in the home that's claiming a carer's allowance or a disability pension, the home is exempt. So this is reason why it's good to get the advice before you start looking at selling the home and all the rest of it, because there are strategies around going into aged care. So that's hopefully that, I don't know if I answered your question. I hope I did.
Look, I think that's quite clear. That's fantastic. And so what would, flowing on from that actually, what would be some of the things people would look for just before we finish for today?
Oh, look, some of the main things, I think, obviously, you know, cleanliness. We all talk about staff ratios. We would all love them. There currently are no staff ratios in aged care, but it's pretty plain to see that if there are, you know, registered nurses on 24 hours a day in aged care, that's a must. I think the things to ask for is whether there's a choice on the menu for food and what the food is that's being provided. Sometimes you can ask things like the call bell wait times, because all of that's recorded. And so things like that, which are things that advocates know about, it's important for you to find out for yourself. If you're going to go it alone, then there's certain things you do need to look for. And obviously, you know, cost is another big one. So,
That's
Yeah.
huge, and I'm sure for our viewers out there, those little details are some of the things that sometimes they can be in before they even know.
Well, that's right.
Those things.
Yeah, coming from hospital or having a fall at home. And look, again, this is the biggest tip that I think we could come out of today, is to be proactive, not reactive. And with that, I think pre-planning is the key. It's important to be able to have those conversations with loved ones and family. Know that there's a lot of help out there, and at the website you'll be able to find all the help you need. And I wish everybody the best, and know that aged care is a positive thing, yeah.
Yeah. Well, that's wonderful information, and it's good. It's good to bring the positives in rather than the other way, the negatives that can so play out in our lives. So, thank you very much, Pauline, for all that information, and thank you for watching our show. For more information, as we were saying, on Pauline and aged care, then please go to our website. Welcome back. And next we have Leah Istarte, who's an artist and energy healer. And she's here today to talk to us about creativity. So what is it about creativity that's brought you here today to share, Leah?
Thank you, Linda. I'd love to talk about that. Well, I've encountered in my life and surroundings people who seem to be a little bit lost. They seem to be in a state of desperation at times, sometimes happy, but since we're human, it's not always possible to stay in a positive state. So I've been thinking a lot about that recently, and as much as we have mindful meditation, which is clearing the mind, there are other forms of not obvious meditative states that can assist us to be in the present moment. And so that might be things like singing, drawing, doodling, walking in the park, perhaps gardening for some. But more importantly, it also gives people a state of mind, instead of thinking of past occurrences, that might keep them in the past, might keep them sad, might keep them in a place that's not conducive to the present moment. It takes them out of that place. And also, if we argue, well, we start worrying about the future, which everyone does, I do. But then I pick myself up and say, stop that. And thinking about the future is counterproductive because we can't do anything about it.
No, it makes us more anxious.
Makes us more anxious.
Yes.
So what's the point? So I think it's important for people to know to do mindful pursuits, to keep themselves present, because in the present is the only time we have. It's the only thing we seemingly can control. It's the only time that we can be spontaneously happy. And so things like that might be, you pick up a book, or a sketchbook rather, or even some people use written books, and when they're done with them, instead of throwing them out, they might doodle in them.
It's a great way to be environmentally friendly, isn't it?
It is. You're recycling. Or you buy just a cheap sketch pad from anywhere and you start doodling. Or you might ask someone to make a scribble. And so with that scribble, you might indulge in, what will I do with it? Will I colour it in? Will I finish it? Will I add extra lines? And another thing you can do with regards to allowing the brain to switch and have peace is you might use the hand you don't normally use to start drawing. It's very difficult. You might think, oh no, how can I do that? But it's actually easy once you try it. The point is this: whatever you do, and I'll go into more in a moment, never ever do it in a state of ego. Never do it in a state of, my goodness, that's terrible. Don't show anybody. If anyone's ever read The Artist's Way, that book talks about doing creative pursuits, but then not having an opinion. Don't show anyone. Don't even look at it yourself. So put it away and leave it. Because as soon as your ego gets involved, as soon as your ego says, oh, that's terrible, that's horrible, what did I do? It just kills the entire process. The process is the process. There's no ego, there's no judgment involved at all. So
Well, that's just all very amazing. There's so much information you
it
have
is,
to
and
share.
we're just skimming the surface here. So it's quite exciting, quite exciting.
Thank you very much for joining us
That's
today
okay.
and sharing all that wonderful information.
Thank you.
And for more information about Leah and creativity, then please go to our website, Health, Wellbeing and Lifestyle. And for now, we'll say bye-bye and we'll see you next week.